Good morning and welcome to PatientflowHQ presentation. We'll be showing you the basic feature on the web application and how we're able to use that to help patients write the most efficient medical notes. We'll be going over some of the important things to consider while you're using the application. All right. So I'm just going to start with this particular situation here now. Let's see. So basically here I have a form that allows you to put all the necessary information. So I'm putting here chief complaint. Let's talk about shortness of breath. Okay. Now, because I know my patient's story, I'm just going to go in and document that. Patient presented with shortness of breath ongoing for about 1 week, associated with cough, productive of whitish sputum, period. Patient also endorses fever, but denies any chills, period. Patient denies any sick contacts and had been in her usual state of health prior to this presentation, period. So here I have the text for my history part, and I'm just loading it on here. So basically, once you put any text in the text box and you press enter, it makes it into a closable chip. So I can add other information. For example, if I wanted to type that, I can type patient. Okay, I can just add, for example, let's say history of hypertension. Enter. All right, you see that? History of hyperlipidemia. Enter. I can add something else and say, for example, also complains of chest pain when she coughs. Enter. So these are all additional information that you can put into the text box that allows you to put history information. Now we'll go on and talk about the workup findings. So we'll come and do the same thing here. And I'm assuming if you can type it, you type it. If you can use a voice dictator like you see me using, I think that obviously is the best scenario. Upon arrival to the emergency department, patient remained hemodynamically stable, period. Chest x-ray shows right lower lobe infiltrates, period. EKG shows no acute ischemic changes, period. Labs remarkable for potassium of 2.9, period. And lactic acid of 2.2, period. Again, I'm going to copy that and put it in text box. So if I have other information, I can add that. Let's see hemoglobin of 9.2. That's one more information. It's also important to note here that we've also added another feature that if you double clicked any text box, you have a drop down list of symptoms you can type in or search. For example, if you're looking for history, so you can add history of CAD, history of CKD, and it automatically brings it to the text box. All right. So these are additional features here as well for the workup. You can search here. So example, you say CT angio negative for PE. There's a drop box of a drop down list of several things you can add here, and we keep updating that accordingly. So basically, I have my case ready, and I just click submit. Typically, doing this outside of having to explain and show in the video, doing this will probably take, from 60 seconds to about 2 minutes to really put all the information. And let's see what it gives us now. So we've sent the information, and this is what is happening. I want you to pay attention to how quickly it is able to provide just incredibly efficient assessment. Just pay attention, just look at what's going on here now. There you go. This is your note right here. You copy, you put it in your EMR. We're also working on the backend integration of that. But this is it. You give it some information, and it gives you just fantastic. And the importance of this, and the reason why we're really excited about this, is that you can see here that all of the diagnoses that it's giving you are all billable diagnoses. And it really allows for better reimbursement, better communication with the rest of the team, because you're really presenting the information. Now, physicians are supposed to be able to do this by themselves, but the work that goes into the construction of language is perhaps one of the reasons why people get, burnt out and frustrated about having to write so many notes. So we know what is going on. We can put the right orders, help the patients, but let the documentation be done by technology in the most efficient way. Again, we're not saying that this is, just documentation for documentation's sake. We're saying this is better, perhaps the best documentation you'll ever be able to do in record time. And that's the point we're trying to make here. Better notes in less time. Fantastic notes in record time. And that's where we are. We hope you guys can join us in this journey as we continue to make this better. We're just in the beginning. There's so many opportunities here. Also, to note that we also have notes templates, for example, that if you wanted, you can come and look at the notes templates, right? And you can copy, you can edit and make it yours, all right? You can copy it and put it in your notes. It's so many fantastic things, honestly, on this platform, and we're truly excited. We'll see you on the next videos. Bye.